There is no question that millions of Filipinos still have minimal or zero access to healthcare in the Philippines. In fact, according to the recent survey by the University of the Philippines National Institute of Health, approximately 40 million Filipinos cannot afford to buy their medications. That is about 40% of the entire nation that lacks the ability and the means to access healthcare services. This problem even becomes more difficult when natural calamities, such as typhoons, visit the Philippines on a regular basis, especially during Typhoon Yolanda. Many of our kababayans were injured, displaced, and even died due to the ravaged situation the super typhoon created. However, the perpetual lack of healthcare services ignited the visionary minds of Dr. Jim Sanchez, a plastic surgeon in the Philippines, in his pioneering creation of the Hospital on Wheels program. Created in 2007, this mobile truck provides state-of-the-art medical facilities compared to that of an established hospital in the country. The idea is to bring services to our kababayans who have no money to seek medical treatment. Apart from regular screenings and checkups, Dr. Jim Sanchez and his team perform surgical interventions under local anesthesia. From minor cleft lip surgery to major inguinal hernia repairs, Dr. Sanchez and his team have saved thousands of lives from the countless life-changing surgical interventions they have performed. In fact, more than 500 hernias or luslos in adults and 200 hernias in children have been successfully repaired under local anesthesia inside the hospital on wheels. Just to give you an idea, a hernia repair could cost anywhere from $60,000 to $150,000 at a private hospital and $20,000 to $25,000 at a government or charity facility. In a hospital on wheels, however, it is absolutely free. This is one of the reasons why Dr. AJ Rosario with Houston Health Department is so passionate about helping this Hospital on Wheels program. In summer 2016, Dr. AJ traveled to the Philippines to bring supplies and volunteer his time by assisting Dr. Jim Sanchez in one of the surgical operations.
It's amazing. I witnessed the van itself in the Philippines. I went inside and I can see the operating room there with nurses. So when I entered it, good thing Dr. Sanchez was performing a procedure under local anesthesia because he's also an expert in just using local anesthesia in major procedures.
Since its implementation, the Hospital on Wheels has traveled thousands of miles to visit the remotest areas where over 10,000 surgeries have been performed. Dr. Jim Sanchez even appeared on CNN World News and various TV shows promoting his project and encouraging Filipinos around the globe to help and contribute on this project. In May 2016, Dr. Jim Sanchez traveled to Houston and presented his project to the Filipino-American medical professional community. Under the sponsorship of Texas Association of Philippine Physicians and the Medical Surgical Missions of Texas, Filipino Houstonians were able to raise money to benefit Dr. Sanchez's program.
This project, a lot of people contributed, and seeing what he can offer to the Filipinos in the community really looked like it could make a difference. And so we were able to raise a good bit of money for this project.
Dr. Sanchez's vision is to purchase 6 air-conditioned buses with 40-foot containers that can be easily deployed as emergency medical facilities during natural disasters in the Philippines and serve as secondary hospital delivering quality healthcare services to the remote areas.
As a president of the Texas Association of Philippine Physicians, I would like to encourage all the Pinoys out there here in Houston and Texas, even the whole world, to help out with this Hospital on Wheels program. Any time, any effort, any love, any monetary donation you could give us will be appreciated. It will help all our kababayans in need at home.
Rex Daniel, PHTV.